How is what you're offering different from me getting my usual telehealth?
Yeah, Caroline, thank you and Ed so much for having me on. Summer Health is a pediatric telehealth platform that connects patients to providers in under 15 minutes. It's a very human feeling experience, as you described, because you have kids. I have 3 kids of my own. There is this visceral feeling of bewilderment or panic when your child gets sick and you don't know what to do. Summer Health aims to turn your phone into its own doctor's office. And so with a simple text message in under 15 minutes, we can connect you straight to a pediatrician. We're live in all 50 states, which makes it really easy if you're traveling to get that kind of care. We're different because we have a very human-centered approach. While I understand that AI has become this big wave and this big phase, we use that to power a lot of the back-end and administrative work of providers so that they can get front-facing and do what they love, which is helping patients.
I'm still kind of questioning what exactly the differentiation is, though, in that I can also get a person on a phone. Is it just that they're directly pediatricians that's slightly different here?
Yeah, so we've got licensed pediatricians in all 50 states who really get to know you. What we aim to do is not just urgent care, but rather whole human care.
Okay.
And so when you text us, it's not just that middle of the night, my child's throwing up, but it's also, what should I pack my child for a nutritious lunch for school? Or how can I deal with separation anxiety at the start of the school year? We offer a lot more than just urgent care, which is where I think a lot of telehealth platforms to date have sort of faltered.
Ellen, good morning from San Francisco. You know, it's interesting, you're backed by Lux Capital. General partner Dina Shakir is somebody we know on this program very well. And at the time they did your seed round, they put a lot of emphasis on you, a founder, like a lot of experience as a healthcare executive. My question is, why did you think you needed to make this app and this company? What gap did you spot?
Yeah, so I had the fortune of getting to build a very large telehealth platform prior to starting Summer Health. But from my own personal experience, I realized just how powerful I could feel as a parent knowing that my children were healthy if we had constant access to care. That is not available in today's healthcare environment because there is a huge shortage of pediatricians. 2 years ago, there was a survey done by the American Medical Association that 1 in 3 pediatricians were planning on leaving their practice within the next 2 years. And looking back 2 years later, we've seen that. About 33% of the pediatric workforce has left. And so what we're trying to do is increase the supply of pediatricians and make it much more accessible. It's something that no other telehealth company has really thought about, and we've leaned very heavily into this message-based care to make that a possibility.
I have lived in this country for almost 6 years, you know, a completely different healthcare system from the UK, where I'm from, where insurance plays such a big role. What is your business model? Do you charge the consumer directly? Are you dependent on insurance coverage for your users?
Yeah, thankfully, because we offer entirely message-based care, we've been able to keep the cost rather low for our patients. Right now, Summer Health only costs $20 per month, and that's for unlimited usage of the service. So we really aim to be accessible to a very broad swath of the population.
I'm looking at your prior experience with Hims and Hers as one of the companies that stand out as your experience. You're also over at Twitter for 4 years at one point. RIP, now X. I'm interested in you talked about AI, artificial intelligence, and that pervades all of the companies that I just mentioned. How are you fighting parents' desire to just get all their answers from ChatGPT, from Bard, and make the feeling as though they've got it all at their fingertips anyway?
Yeah. We think about this a lot at Summer Health because I think there is a temptation to go to a service like ChatGPT and just ask your questions. But ChatGPT doesn't have a lot of the backstory that we get from those frequent touch points. We tend to know a lot more about your child than even your own pediatrician because our parents come to us multiple times per month asking those small in-the-crack style questions. And therefore, we're able to give you extremely personalized care. But we're not shying away from AI, and we're not doing without it. We believe that there's a lot of power in powering the administrative work that our providers are doing. So a lot of the back end of Summer Health is still powered by artificial intelligence, but that you can get a very human touch, the I can help you. And we have a lot of pediatricians who are parents on the platform and can give a lot of personal recommendation from their own experience as parents.